Hey everyone, welcome back to another Facebook Live interview with the Spine Health Foundation. I'm your host, Erica Anderson, and I'm excited today to be talking with Larry Grine. He's a physical therapist at the I'm going to say it wrong, Virginia Therapy and Fitness Center, VTFC, and a good friend of the Spine Health Foundation. Larry, thank you so much for joining us today.
Thank you very much for having me.
Yeah, absolutely. So when we're doing these interviews, we just like to get to know people a little bit. So we would love to hear a little bit about your background and what brought you to this work.
Yeah, I started my journey. I was looking to do engineering, and then as an athlete, I played soccer my whole life, and got multiple injuries, particularly ankle sprains, and as a result, I got introduced to athletic training and physical therapy. So initially, I was pursuing a degree in physics and in engineering, and then I played soccer in college. Was in the training room quite a bit. Just really enjoyed the atmosphere. Really enjoyed the science behind healing and getting people back on the field. And so I started looking into that a little bit more, and I started pursuing the field of athletic training. Became an athletic trainer, student athletic trainer in college for a few years, in addition to being an athlete, and then immediately leaving college, I then became a certified athletic trainer and worked in a physical therapy clinic. At that point, it was like a capacity of like a physical therapy assistant with the full intent that I was going to go on to become a physical therapist. So you have a little bit more autonomy as a physical therapist and guidance. And then journeyed down to the University of Miami, worked with their football team that is a very high-level football team at the University of Miami in Florida. Continued with athletic training as well as working with my physical therapy degree. And then made my way back to the Virginia area as a physical therapist and a dual athletic trainer. So I've always kind of had my feet wet in the sports medicine standpoint. And so that was kind of my journey, and kind of made my way in this department, and then was able to join Virginia Therapy and Fitness Center and open their doors as the physical therapy department for the Virginia Spine Institute. And then we've been connected to the National Foundation for Spine Health as a result also.
Yeah. Okay. Awesome. It's always so interesting to hear, how people got to where they are and why they're passionate about what they do. So one of the things we focused on this year, last month, we were focusing on non-surgical solutions, just as we want to make sure we're putting all options on the table. So when someone comes to you and maybe they're sort of dead set against having surgery, but they really want to get better, what's maybe sort of the first thing that you talk with them about, and then, proceed on with a plan from there?
Yeah, I mean, our whole goal as physical therapists is to try to keep people out of surgery. Now, sometimes surgery is, in the end, what is needed to happen because anatomy has changed or there's been a trauma or injury that really you can't fix some things through physical therapy, but physical therapists can do quite a bit. So we always try to do conservative management, which would include physical therapy prior to considering surgery. So the evaluation is critical. So when you come to Virginia Therapy and Fitness Center, you're getting a comprehensive evaluation, and you're kind of laying out all the different components of their injury, whether it be a shoulder that needs surgery, or a hip, or a back, whether it be the neck or the low back, that are being considered for surgery. But there's a lot of times where we can change their biomechanics in a way that actually can offset their inflammation and their pain. They can actually allow the body to heal itself. And if we can trigger that response, then their rehabilitation potential is good. And if they can continue on physiologically, it takes several weeks. It takes 6 to 8 weeks for patients to get better with routine exercise. So the journey is not necessarily short, and it's not a silver bullet, and it requires patient engagement. But our goal is to try to conservatively manage anybody that comes through the door. And in the end, if they've gone through a full course of excellent physical therapy, because not all physical therapy is good, then a couple choices remain. And surgery might be a choice that's at the end of that decision tree with respect to after they've completed excellent physical therapy. But if they haven't had good physical therapy, they just had shake and bake, they do modalities, hot packs, ultrasound, and some exercise, and not manual therapy, then ultimately there might not be a clear decision at the end, and hopefully surgery won't be their only option.
How do you, because as someone who has done physical therapy myself for several different issues, that timing can be discouraging. Like you're feeling like it takes forever. How do you encourage people to stick with it?
Yeah, I mean, that's part of our job is to ultimately, help motivate the patient to understand what their injury is and understand what their prognosis or the timeline for healing. A lot of tissue in the body takes about 6 weeks to heal
Mm.
for the most part. So when you're in that normal healing time, trying to help them be patient and understand that some of that will take place. But what we find is if we can give them a little bit of hope, and that hope is giving them a little bit of relief, they can kind of see that things are progressing well. We can really help things. So the body is amazing and it heals itself. But when you provide a physical therapist that has excellent knowledge in science and skills, they can really accelerate that process quite a bit.
Another focus that we had this summer was aquatherapy, and I have always thought that swimming and aquatherapy was such a great, not just cross-training exercise, but a great thing to use if you are recovering from an injury. And I know that you guys have a focus on that, and you have that. Is it called an aqua treadmill?
Yeah, it's called an aquatic treadmill.
Aquatic treadmill.
It's the Hydroworx 300, which is an excellent piece of equipment. And if you can envision a treadmill that's been enclosed in a glass walled container that has a treadmill that works and operates quite well. Pretty highly sophisticated, but an excellent piece of equipment. We have used this. We had aquatic therapy where we used to go to a fitness center and use their pool, but now we have access to it here in our own facility. And what aquatic therapy does for us is it just allows people who are just not able to function well in the normal gravitational environment of everyday work. And you can get them in the aquatic environment and they're buoyant and the water helps lift them up and it takes pressure and load off their joints in their body. And if you have water up to about your chest level, you're only working with about 20% of your body weight. And you're able to move through normal movement patterns, and normal movement patterns are really critical to recovery and rehabilitation. And so ultimately, in that aquatic environment, we can do things that we can't do on land or in the clinic. And it really allows us to expand our scope of therapy, especially when people are in a lot of pain or have a lot of poor gait patterns or movement patterns. We can really clean those up and accelerate their rehabilitation, whether it be a lumbar surgery in the low back, whether it be a shoulder surgery, foot and ankle surgery, or we do a lot of anterior cruciate ligament reconstruction. We get them back walking and running much earlier than they would be outside of an aquatic environment. But it's controlled and we can keep things, we can adjust the water level. So the amount of pressure and load is quantified. And it's an excellent means to get people better even faster.
So how do you decide if someone's a good candidate for that?
Usually the aquatic treadmill is for people that we need to get them moving, but they can't sustain any kind of endurance activity on land. So say, we know walking is an amazing, cardiovascular event. If you can walk for 30 minutes a day, you can help yourself from a health standpoint tremendously. But somebody recovering from a lumbar surgery from Virginia Spine Institute or wherever, maybe you can only walk for 5 minutes because you have so much discomfort. Because surgery is invasive, it's necessary, but it's needed. But we can get them to walk for 20, 30, 45 minutes in a controlled environment without stressing their body. And they're able to move through those patterns and they can fulfill a significant cardiovascular activity without stressing the areas that have been problematic. So we can really enhance their health and the way their body responds to movement.
Oh, that's really cool. I kind of wish I'm sure I'll have to do physical therapy again. And I hope I go somewhere that has one of those and they tell me I need to use it.
Well, we're the only clinic in Virginia that has a Hydroworx 300.
Oh, wow.
So, it's an excellent piece of equipment and we have people that come in and, even Galen Rupp, who was the Olympic marathoner, did 40% of his training before the Olympics in an aquatic treadmill.
Oh, that's so interesting.
So you can not only as a health professional, you can do training, but as a person doing rehabilitation, you can also benefit as well.
I'll have to look that up. I definitely follow the marathon world a little bit. So, so this is a big question. So when people are sort of say they're finishing up, it's almost time to be done with physical therapy. What is it that you want to stress to them? Like, because you don't want to see them back. You want them to be healthy and not need physical therapy. So what are some of the most important things you might tell someone as they're leaving?
Yeah, I mean, what's important about our practice is our goal is we want to transition somebody from needing our help to get them better, but then working towards them getting independent and being able to manage themselves outside of our clinic. And so they should leave our practice with a comprehensive home exercise program that they can manage on their own successfully, and they can manage that and they comprehend the exercises. They can do them with good technique. And so they should be able to maintain that exercise. And in order to be healthy, you need to be active. And so our goal is to have people be as active as they possibly can without doing anything that's going to put them in harm's way. So when they progress through our practice, they're going to start off needing our help with a progression of being independent and having a home exercise program that they can work on their own. And then we actually, a lot of times now, we will have patients come back and touch base with us, on a month-to-month basis and get an upgrade on their exercises so they can progress even further on their own. But as we get them, we want to know what their functional requirements are. If they want to get back to tennis, what they want to do to improve their life and get back to what they want to do. And our goal is to match that with the exercises and the therapy that we provide. But being independent and being, diligent in doing things that are active in your lifestyle are really important.
Yeah, I've always appreciated that about physical therapists I've worked with, that when I go in, they're always very sort of reassuring that like, hey, we want to get you back to what you love doing. And that, I think they know how everyone is a little bit nervous, a little bit scared for the future of what that might bring. So I think patients really appreciate that sort of perspective and how that's presented when they come in for therapy. So Larry, thank you so much for your insight and your expertise. We really appreciate it. And thank you so much for all the great work that you're doing.
Excellent. Thank you for having me.